This is Dr. John Sadie, President of your Home Team Care, which is a multi-diversified management services sales staffing company. And today we're going to talk about and accentuate and differentiate on what your Home Team Care does versus other competitors and why you should choose us. Number one, we're a physician, nursing, staffing, personal care company. And to my knowledge, there's not another one in the state of Tennessee, the United States. Secondly, we have the depth of caregivers working already for our company because we have a hospital-based sitter business, which we assess behavioral psych patients, and those sitters, about 30% of them have experience in doing home care, whether it's working with compatibility, which is just getting along with the elder, driving the elder somewhere, whether it's a more progressed, advanced disease state. They have a caregiver experience in Alzheimer's, dementia, Parkinson's, etc. So we have that pool and luxury of a resource. We can contact those sitters who are with us to see if they have caregiver experience. We already understand that since they've come through our orientation and training. So we already know those folks that are experienced the caregivers in certain disease states, and we're able to pull from that pool. No one else in town has the luxury, to my knowledge, of having a 5-star bench like an Alabama, Georgia football team to bring people off that are experienced. Third thing we do is we are the only company, there may be 2 others in town that do nurse rounding, but we do nurse rounding free to help the caregivers and also to inform the families and patients of the continuation or advancement of their disease state. Whether a caregiver that's very well trained can, again, assess this and be that caregiver, or whether or not we're going to need a more advanced CNA or somebody to work with the elder so they can stay in the home. Fourthly, we're very flexible in our customized services. We'll do anywhere from 4 hours to 24 hours a day, and that really separates us. With the fifth reason is we take 4 kinds of insurance, actually 5. We do VA, which is the former veterans of the United States, Department of Labor in Anderson County. Those are folks that have governmental policies, particularly for cancer. Number 3 is long-term care policies. Your Home Team Care is the only company, I believe, on all the panels of long-term care. Fourthly, we work closely with ETHRA and those underprivileged. And fifthly, we've just joined Choices, the Blue Care component, for also the underprivileged. So by the mere fact we have 5 kinds of insurance, that does really help us. 6, we're always trying to do better and evaluating our client, making sure that we are taking care of the power attorney and the client, and we have 5 kinds of insurance that we deploy for our caregivers, which no one else does. We're actually 6. Number 1 is we have transportation insurance on liability, so that if they're driving the elder's car or their car and there's a wreck, we can pay for that liability car insurance. Number 2, we have workman's comp for all our caregivers, meaning if they fall in your house, break their arm, our hospitalization will pay for it. Number 3, we have malpractice. They're like a physician and nurse. I am an ER physician, and we have the same 1-3 million on them as we do our nurses and our doctors. And number 4, we offer medical benefits, 5 dental benefits, and 6, we have theft insurance. Although we certainly are glad we have not had to pay out any theft insurance. There have been reports across the country of caregivers taking things in elders' houses. So I just want to let you know that we've done this for your peace of mind. So we have a lot of money invested in our caregivers per hour, and we do customize that for you. Because of our depth, if a caregiver shouldn't be aligned with what you think they're doing, or maybe there's just a personality change, we're able to have that depth to make that change so one family is not stuck with a caregiver because it doesn't work out or align with what they perceive to be their needs. All in all, our job as a company is to provide you peace of mind. We want to do it in the best solution, flexible way we can, and we like to assess to make sure we give you feedback on what kind of hours of coverage. In the end, it's your decision, and we're delighted because our whole goal is to focus on making you feel better, the power of attorney, the client, and how we're handling things. We do nurse rounding free, so we're often able to assess the client, be able to pick up whether or not we need to advance our care or maybe there's more extensive coverage, but obviously that has to be done with your approval. So I've named you about 7 things why your Home Team Care differentiates itself. We're delighted that we can go anywhere in East Tennessee or anywhere in the United States should we want to provide this service. We're not a franchise. That's a good thing from our vantage point. So again, call your Home Team Care, 865-332-5000. That's your home team care, 865-332-5000, and ask, and we'll give you a free safety assessment at home with our nursing staff. And we're delighted to serve you. 865-332-5000. I'm Dr. John Staley, President and CEO. Have a great day. Thanks.